Hi, I'm Peg Luksik, U.S. Senate candidate from the state of Pennsylvania. We're about to talk about House Bill 3962, Nancy Pelosi's health care bill. This is going to be a bit of a different presentation. There's many groups that give you a section-by-section analysis of the bill, and most candidates just say they're for or against it and talk about the most egregious parts. But we need a new kind of campaign and a new kind of candidate today, one that sees their role as serving the people, giving you the ability that you need to be able to advocate effectively for yourselves and your families. So this analysis of the bill is not meant to be comprehensive section by section. What I did was I actually read the bill so that I would have a sense of what it said from beginning to end, to get the flavor and the trends in the bill. And then I built the trends for you so that you can see how the financial pressures in the bill will affect you and your family. You will see some of the areas where the federal government is invading areas of your lives that you really wouldn't think would have anything to do with health care. And you will have the ability to effectively speak to your elected representatives and senators to give them what you think is wrong with the bill. Now, this is a fairly technical presentation, so we've broken it down into a question and answer format. Each section of the bill that I am speaking from, I will cite for you so that you can go back and look it up yourself. I do not add editorial comments, so I don't say it's terrible, it's wonderful, it's bad, or what I think. This is about me giving you information. I know that's really different for a candidate. Most of the folks who run for office today tell you what to think and tell you how, if you just elect them, things are going to be wonderfully better. Usually, they don't give you any information at all. And in the Senate race that I'm involved in right now in Pennsylvania, that's exactly what's happening. You have Arlen Specter, who's running as himself and openly telling you that he's going to support the provisions of this health care bill, even though he admits he hasn't read it. You have one opponent on the Democratic side and one on the Republican side, whose campaign is basically built on the fact that they're not Arlen Specter. But they don't tell you what they think. They don't give you information about what they believe or who they are, nor do they give you the pieces that you need to be able to effectively speak back to government. I believe that the way someone campaigns is the way someone will govern. So if you want a representative or a senator who is going to give you information, who sees their role as advocating for you, as giving you the tools you need to be an effective citizen, then you need to look for someone who runs their campaign that way. I've built my life doing that for the citizens of Pennsylvania and in some cases the nation, whether we're talking about education or taxes or some of the pro-life issues or the family issues. My history has been to give you the tools and the information that you need to effectively talk back to government. That's how I intend to govern. I know it makes me kind of unique on the political stage, but I believe it's time for us to have a new kind of politician, one who sees their role as representative as the defining piece of their role. And that's what this presentation is going to give you, the ability to understand the trends and the implications in this health care bill so that you can talk intelligently with your friends and your neighbors and with your elected representatives to be able to effectively speak back to government. Now, let's begin. Does this bill ration health care? The short answer is yes. Section 101, the very first section of the bill, creates a high-risk pool for individuals that have not had health insurance for at least 6 months and have a pre-existing condition. The program is set to begin on January 1st, 2010. The government can charge you premiums that are up to 125% of the market standard for the same coverage. That means that if private coverage would cost you $100, the federal system can charge $125 for the same thing. The federal program will begin with an initial appropriation of $5 billion to cover their cost, both claims and administrative. There are not supposed to be any annual or lifetime limits to the benefits you can receive. Sounds too good to be true. It is. Section 101H2 says if there's a problem with funding, The Secretary shall make whatever adjustments are necessary to eliminate the deficit, including reducing benefits, increasing premiums, or establishing waiting lists. That is rationing. Question 2. Does this bill mention tort reform? Oh yes, it does. Section 2531 gives an incentive payment to states that enact a medical liability law that complies with the standards set by this federal law. In other words, the federal government is telling the states what they have to put in their tort reform laws. The contents of state laws is spelled out in Section 2531A.4. It says that state laws may not limit attorneys' fees or impose caps on damages. So any attempt at tort reform that does not actually address the problems with medical malpractice lawsuits are the only attempts that will be allowed. Some people are calling this a kiss to the trial lawyers. Question 3. So the bill is telling the states how to change their tort reform laws, right? Well, it goes way beyond that. Section 1790, called Rule for Changes Requiring State Legislation, says if the Secretary of Health and Human Services determines that a state plan requires state legislation, for that plan to meet additional requirements imposed by this bill, the state has one legislative session to change their laws to match this new federal language. If the state doesn't change its laws, the state will lose all funding for medical assistance under Title 19 of the Social Security Act. That is a very big stick. We've just been talking about how the federal government invades the purview of the states by telling them how they have to change their tort reform laws and all other legislation. In part 2, we're going to be talking about the effect of this legislation on private insurance providers, employers, and you.